Good afternoon. I'd like to call to order the meeting of the Pitt County Department of Social Services Board of Directors this Tuesday, June the 9th, 2020. And we're going to start the meeting by observing a moment of silence. Thank you. Thank you. Susan, do we have anything for public comment? We have no public comment today, so we'll move on. And I'll need a motion to adopt today's agenda. So I have Dr. Bunch. And do I have a second?
I second the motion
Okay.
to accept the agenda as printed.
Okay. So that was, I guess that was Mary Perkins at second. Thank you.
Yes.
Okay, so moving on to the previous meeting's minutes. We need to take a look at those, and if I could have a motion to approve those minutes, please.
And it says
Okay,
distributed.
Mary Perkins Williams. And could I have a second, please?
So moved.
Okay, thank you, Catherine. Okay, I think we're going to move on to awards and recognition. I think we have something special planned for that today. So Jan, I'm going to turn it over to you.
And I'm going to turn it over to Dr. Bunch because this is a recognition from the ECU School of Social Work for the department.
We're not.
See if we can get you unmuted.
Yeah, we're not hearing you, Dr. Bunch.
We'll give it just a second, and if we still don't get it, we'll do it without you.
Okay, we may want to move forward, and
Yeah.
if she gets unmuted, we can have her
You can-
join in. How's
That's
that?
right. You can add extra comments while we work on this. The East Carolina University School of Social Work presented our department the Outstanding Field Agency Award for the past year. It was supposed to be given to us on March the 20th of 2020, but due to COVID, we were not able to do that. It speaks to the recognition and ongoing commitment to social work education. And I want to present this to two of our staff. Cynthia and Keisha. I'm going to present it to them. Cynthia is with our adult services program, Keisha with our child welfare program, and it's them and their staff who made this possible. So I want them to have that.
Thank you.
Thank you.
Congratulations. Having worked with social work students for many years, I know how important it is to have good field instructors and good agencies. So I appreciate you doing that. Okay, thank you very much. Okay, now moving on to items for discussion. Jan's going to talk about North Carolina Child, the data card, and you have a handout regarding that. Thank you, guys.
Thank y'all. Okay, NC Child puts out on a regular basis the child data report. And this is sort of the report card for the state and the report card for counties around several key issues. The priorities are a strong start for children, economic security, nurturing homes. Let me get this up on the screen where you can see it. There you go. Adequate and reliable family resources, personal safety and responsible choices, training and documented skills, and health and access to timely care. And so that's what they're focused on. I can let you know, you have a handout that looks at all of our surrounding counties as well as the state and compares us, but it looked to us like it would be a whole lot easier to see on the map. So you can see what counties that we're looking at. They're very similar to us, either in size or location. We did not look at some of the much smaller counties, just so that you could see that. And I've got to take this mask off so I can talk. So first and foremost, the first issue is women who receive early prenatal care. You can look at this and tell that Pitt County is doing a pretty good job, but we need to do a whole lot better. We were at 80.1%. We have gone down. We need to be at least, this is in the first trimester, and we certainly want to be doing a better job of women receiving early prenatal care. But we are certainly above many of our surrounding counties. Babies that are born at a low birth rate. Again, looking at Pitt County, 11.6% of our babies are born at a low birth rate. Again, compare that with some of our other counties. Onslow, Craven, Beaufort, Wayne are doing better at this than we are at this point. We certainly need to work on that. We have, again, had a minor increase of babies born at a low birth weight in the last year or so. So now looking at babies born preterm, and preterm is defined as before 37 weeks. Again, Pitt County, 14% of our babies are born preterm. We are one of the higher counties in that area too. And this again is a slight uptick from the year before that was looked at. So this is basically 2018 data. So just wanted you to take a look at that. This is an area that certainly the Department of Social Services, the Health Department, and all of our partners in the community need to be working on as it relates to making sure that our babies get a strong start. And that starts with moms being healthy and having really good prenatal care. The next slide we have has to do with family economic security. And this sort of lumps a lot of things together. It looks at, what's the median family income. It looks at the fact that we have a lot of children food insecure. All of those kinds of things came together, and then this particular slide was part of that. The poor and low income homes, 50.5% of our children here in Pitt County are living below 200% of poverty. And to put that in perspective, that's a family of three making less than $20,780 a year. And this is looking at, again, the most recent information available, which is 2017, 2018 timeframes. Compare that with the median family income in Pitt County, which is $44,315 in the period of time 2014 to 2018. So we don't have a huge median family income, but we certainly have a lot of children living well below that income level. Again, looking at the surrounding counties, you can see where many of those fit. And in fact, compared to some of our surrounding counties, we are actually looking better than some of our surrounding counties. Looking at nurturing homes and communities, this talks about the delinquency rate. Looking at youth ages 6 to 15, and it's per 1,000 youth. Pitt had a 23.3 youth delinquency rate per 1,000 youth. So between that's between the ages of 6 and 15. Again, that is significantly higher than the state of North Carolina, but you can see Pitt and Beaufort both have high rates. Looking at high quality education, Pitt County has worked really hard to improve third grade reading. There are a lot of programs going on here in Pitt County to push and improve that testing score, because that is such an important milestone for children. And you can see that Pitt County is at 52.8%. That is a significant increase over the last couple of years. We were at 44.4%. So definitely all this work has paid off. We still have a way to go. And you can, again, see how we compare with some of our surrounding counties. High school students graduating on time. Pitt County is at 83.3%, knocking on the door of 84%. This was 2019 data. And again, we have made some progress here, still have a long way to go. Got to aim it right. Looking at health and wellness. Again, this I think speaks to our low income and some other kinds of issues. Pitt County's children without health insurance right now are at 8.8%. That would be 2018 most current data available. And this is not good, because in 2017, we were at 4.9%. So I don't know what has happened about children losing access to health insurance. Certainly, the Department of Social Services is available and stands ready to take applications on children that meet those income criteria, and you know, $40,000 or more, you could still potentially get health choice. So we need to do a better job, it looks like to me, of marketing the health insurance that we have, and then of course looking at the other factors that might be part of this reason that we're not seeing children having adequate health insurance. Looking at our infant mortality rate, Pitt County in 2017 was at 8.8 per 1,000 live births. Today we're at 6.7 per 1,000 live births. That's still not where we need to be. And so we need to continue to work really hard on improving our infant mortality rates. And I know there are several groups that are working on this, but this is of great concern. Our child deaths per 100,000 in Pitt County, 80.1 was 87.2, so definitely going in the correct direction. That was 2017. The figure on the screen is 2018. So I share all this with you primarily to say that Pitt County has some way to go. We need to work as a community to try and figure out how we can impact some of these things. You know, one of the things, certainly teen births, there's been a lot of progress there, but we still have a high number of teen births. We still have, you know, children in households that are food insecure. 15% of our adults in Pitt County lack health coverage, and that probably speaks to some of the child health coverage issues. So there are lots of things that we could be talking about and looking at and trying to see how we can make those connections. And so that's why I thought it was important to kind of share this data with you, and certainly would welcome a discussion by the board on how we as a department might want to look at this and address this.
Absolutely. So any comments or any feedback for Jan? I have a couple questions, Jan. You know, I know that when you look at the first set of slides there in terms of babies born preterm and low weight births, I know that sometimes in the past, since we have the regional NICU here, sometimes babies coming in here get wrapped up in that data. Are these for sure just Pitt County births?
I don't know. I need to ask that question.
Yeah. I
My
know.
assumption is they're doing it based on address,
Okay.
but I will confirm that.
Yeah, so that was just a question, because I know I've been involved in some other things since we do have the regional center here, those numbers get wrapped up. And then on the last page, in terms of child deaths per 100,000, we don't have a state reference there in terms of numbers.
I can provide that to you. Hold on just a second. That's 57.4.
Wow, yeah, so we are up there. Mhm. Yep. So other comments for Jan?
Yes, this is Catherine Nelson. Jan, can you help me understand how you define the delinquency rate in Pitt County?
But again, these were done by folks outside of Pitt County making that, doing that definition. But basically, what they're looking at is the number of youth who are being referred or being charged in delinquency with the juvenile court system.
Okay, thank you.
Mhm. Others? Go ahead.
Ms. Elliott,
Mhm.
the question that Jim asked about the addresses for the children, you said the addresses were what you use as to whether or not they were in the county. There is an area in my district has Washington addresses.
Right.
So where are they?
My assumption, and again, this is data that is gathered through a large evaluation group. But so my assumption would be based on the county lines, they would have a way with GIS and that kind of thing of determining where those folks lived based on their addresses and which county they were in. It may not be to that degree of sophistication, but that would be my guess. And that's why I'm going to confirm it, because that's what Mr. Cox's question was.
Mhm, mhm.
Are there
Okay.
others? I mean, this is good information, and I think it's, Mary, you have another question?
Thought I put my hand down. My hand down.
Okay. This is good information. I would encourage everybody to kind of look over it and think about it, and maybe we can bring this back to another board meeting. Because I think it's really relevant to kind of a lot of our discussions. So I would encourage you to hold on to it and look at it and study a little bit more, and maybe we can continue with this discussion. Thank you, Jan.
Okay.
Yeah, I have another question there.
Yes, Ms. Elliott, I can barely see the writing on the map. And I know we had a discussion at one of our board meetings, county commissioner, about mortality and the numbers. I can recognize some of the counties, but can I get a larger slide
Let's
presentation?
blown up a little bit.
Yeah, I was trying to hear your question. I think you were talking about the infant mortality discussion that I think was held with the commissioners and with Dr. Silvernail during some of his budget presentation.
Yes.
And certainly that is a big issue in Pitt County and something that the child fatality team looks at, the child protection team looks at, even though it's not part of protection, it is part of our overall looking at health. The health department certainly is working hard around that with the other partners in the community. But that's something we've made great progress in, but we sort of backslid a little bit, and we need to move forward. And those of you who did not see Dr. Silvernail's presentation, I can say that children of color were the primary folks who were having, dying young, dying before their first birthday. And so that's the group that we really need to be focusing on, getting good prenatal care, getting all the services that they need up front, and then after they're born to make sure that they're getting that healthy, good start in that first year of life.
I was in another meeting with another group, and this came up. It would be good to have the statistics broken out. I think it would help us to know. I know I always say sort of like in a light way, I tell the residents or the parents to plant a cabbage and a collard. But I want to talk about good nutrition. And I do know that some of the opportunities of using their cards in places that the food is already done and there's a lot of junk. Because I have seen some of the grocery store carts and what's in it, a lot of sugar. Uh, I didn't allow my children to eat cornflakes that had the Fruit Loops, but they could eat the Cheerios without the sugar. So it's choices that I don't know how we're gonna address it. Uh, we just have so many issues.
Well, one way I think that is really helpful to address some of that would be the WIC program, because the health department works with families when the children are very young around getting good, healthy eating habits. So I think that's one of the ways that we could encourage families to get that kind of support from WIC. Helps them buy the healthy cereals, buy the healthy milks, the cheeses, those kinds of things, fruits and vegetables. And so anytime you get the opportunity to talk to somebody who's pregnant or who has children under the age of 5, certainly encouraging them to participate in WIC. Obviously, there are some requirements that you have to meet, but a lot of our young folk, our children and their parents would be eligible, I suspect, for the WIC program.
Those teen pregnancies that was mentioned during this meeting, when you look at that, do you look where they are or where they're located in the county or what? I know there's not a whole lot over here, and it's nothing but food, fast foods, but I'm curious as to what kind of impact that is, because they can use a card at McDonald's now.
Yeah. Again, this data was collected from a statewide database and given us a snapshot of what our county looked like. We can certainly, if you want me to, dive more in depth as to what's going on and present that around our teen pregnancy here in Pitt County. What's being done to address it and what more maybe we could do, as well as get some idea of the numbers.
Well, I certainly am not trying to create more work for you, because I admire the amount of work that you have. And I certainly like to see you stay here a little long, more than you expect to stay here. And I hope your truck don't ever get paid for. But it would help us know what we can do better. Maybe that's a positive way of doing it. I'm trying to find positive ways to express some of the things that I'm feeling. And that is it.
Yeah, and there is, I know there are several programs for young girls here in the community. And I think that's one of the ways that folks try to address teen pregnancy. I know I sit on a work group with folks from Daughters of Worth, and I think that's a group that's working really hard to they're not necessarily calling it addressing teen pregnancy, but I think with the work that they're doing, that's going to help with the teen pregnancy rate. And there are other groups out there, but that's one I happen to hear about a lot since I'm on the same board with her.
Well, I was creating a database of mentoring before Mr. COVID came in. I call it Mr. COVID because we don't know a whole lot about him and where he comes from. So, and they were going to do some mentoring of young girls. A lot of times you can tell a child something who's your own, but they hear it from someone else even better. And I'm familiar with that, but we had some, and I don't know how we're going to do that now. So I have to find new ways of doing things. But I was working on that and was going to go to the JCPC with it. We have a group of guys. I have 100 and some teenagers and less than teenagers in it, and the parents come through the Lee app, and they asked me, do we have something for their children, young ages? And I'm looking and I'm trying, and anything you have come up, I don't know how we can do it now with the COVID, because I think they all need to be staying home and playing in their own yards.
Yes, thank you, Mary. And we'll look forward to kind of visiting this information again and give Miss Elliott a chance to kind of do it a little bit of a deeper dive. That's good information to have. Okay, moving along, the plan for return to the new normal. So you have that in your board packet too. It's the department's plan to kind of open back up, I guess.
Right, right. And of course, we never closed, but we have been able to do a lot of things through waivers that the federal government has allowed us to do, which and by that I mean it has allowed us to do more things remotely.
Correct.
And so as we start thinking about folks coming back into the building for services on a much broader scale than have been now, we, along with the rest of the county, have been trying to figure out how to do that and keep folks safe. So this is my beginning stab, and the work of the various managers worked on this too, at how we might do that, and we will continue to fine tune this. And once we have some more input from folks, we will be taking it to Dr. Silvernail for his overview too, or review of it. He did walk the lobby with us and part of the building, and some of this reflects some of his comments at that point. The main human services lobby, and I'm going to talk about it the most because that's where the high volume is. On many a day pre-COVID, and I say day, when you look at the whole month's data, you could see we have over 3,000 folks coming into that building on any day for services. And so, I mean, over any month coming into the building for services. So that's a lot of people coming through our lobby. So looking at trying to determine how many folks we can support in the lobby and keep social distancing. We took a look at that, and we do believe spread out, you could accommodate up to 45 people, maybe a little less. The child support waiting area is much more compact, and so probably about 5 to 6 folks there. We've asked for decals to go on the floor so that as people move chairs around, it'll be easy to move them back. Certainly if I come in with my spouse, I'm going to want to sit closer to him, and so I might move a chair over, or if I come with children. But we need to be able to keep those chairs distanced when they leave. So we'll be able to tell based on the decals. Face masks certainly will be available for staff and clients who want them and need them. We are working really hard to try and get sanitizing stations placed around the lobby and in the building, and you'll see that in any of the buildings that we have. We would call clients and have them interviewed individually. And then as we call folks out of the lobby, we would allow more folks to come into the lobby if need be to register for interviews. We are going to fix it so that and mark it so that you come in the front entrance and you go out the side doors after you're through being seen. We've talked about if there's a large number of folks waiting to be seen and can't get into the lobby. Some of our folks come by bus, some of our folks are dropped off. Some of our folks come in their own cars. So if those are coming and not in their car, or if it's not comfortable to wait in your car, we have talked about trying to get some tents up to sit on the front lawn at the building with chairs that we could space out for those waiting to be seen while spaces open up in the lobby. Again, face masks would be available out there if folks wanted them. Clients could wait in their car. We would certainly get their information so that we could call them when it is time for them to move into the lobby if that's what they want to do. We've talked too about trying to minimize our long wait times and reduce the need for folks coming in at any point in time by trying to continue to do as much as we can remotely. If we have to have folks outside, we would try to have hopefully some staff, maybe temporary staff, to work between the lawn and the inside to move things around, maybe take materials in, pick up applications so folks don't have to go in. Anything we can do to reduce the numbers of folks coming into the lobby, again, to take care of some of the spacing issues. So if you had somebody outside, they could greet the person, they could review the application if they already had it filled out, they could date stamp the application, they could get that application inside, and then we could call the individual by phone or something like that in order to complete that interview. The bad thing is if you drop off an application and you didn't put your phone number on it, or you drop off an application and you didn't sign it, that creates problems for all of us. So the key thing is making sure we have a good contact number and that it's been signed. Certainly, there would be the option for face-to-face interviews if anybody wanted to do that. There we have in our walkthrough with the doctor and with the county engineer, we talked about for those folks who interview on a regular basis, putting up some barriers similar to what you're seeing in a lot of places where folks communicate. And it's about, I think we talked about a 24-inch plexiglass or Lexan type of a barrier being put up. For those who don't interview very often, but who do sometimes need to interview, we would be setting up some stations where you could go and have that kind of protection to conduct an interview. But, you know, trying to build those kinds of barriers and install those for the numbers of staff we have was pretty prohibitive. So we're trying to triage that. The other thing that we're talking about and still trying to do some research, and I think some of there are a variety of providers here in town that are already using this, is there's an option that would allow you to use your cell phone and check in. It's you would use a cell phone app. You could check in from your car and you would not necessarily need to interact with anybody until it was time for you to be called in. So that's something we're looking at. If there is, we'd have to determine the cost, how long it would take to get it in place and that kind of thing. But we have talked with the company. So perhaps that would work for us. So that's a lot of what we're talking about at the Human Services Center. Some of the same kinds of things are going to be at the county office building, just not the size volume. We have a lot less traffic in the county office building. We would obviously mark on the floor to promote social distancing like we're going to do at the Human Services Center. We'll offer masks to folks and to staff if they want them. We're going to continue to encourage remote meetings wherever possible. And we will limit size of meetings, face coverings, using face coverings, and all those kinds of things based on what the health director, the state, and the governor have recommended. We will begin to do family meetings and visits again, probably in the not too far distant future. We have very limited meeting space here in the agency to do those kinds of things, but we will need to do them because there are very few places that we can take families now for family visits or family meetings. So what we have said all along is that all parents would be required to wear face coverings and to wash their hands or use sanitizer before they visit with their children that we have in foster care. We would inquire about health. We would do temperature checks. We would do a lot of the same thing for the foster children. We would talk to the foster parents to ensure the children are well before we bring them in here. So all of that kind of thing would be available. Sanitizer would be available. We would, since it, you know, we would try to limit the numbers in the room. And then following visits, we would try to spray down those rooms with some disinfectant before the next family came in. We do have for folks who are visiting, besides the masks and for our staff too, we have, you know, gowns and those kinds of things if we think we need it. And talking with Dr. Silvernail, generally, as long as you've washed your hands very well and are wearing the face covering, he feels that would be sufficient in most cases. We're trying to put hand sanitizer throughout this building. I see we have a hand up. We've been given alcohol wipes and gloves to staff, masks, gowns, whatever. And we're telling staff that if you're sick, you have to stay home, go to your doctor, get tested, and let us know before you come back. We have to determine if your test was negative or not. So I'm going to stop. I see you've got hands up, and we will answer those questions and see where we need to go from there.
Yeah, I think Mary was the first one up. Mary?
I was thinking about the training room when you have those group meetings that you need to make. The one down, let's see, when you come in the front, you turn to the left and walk all the way down there.
Right, room 145 in the Human Services Center is the biggest training room we have.
And would that be a good consideration, or have you thought about that?
We are using that room for a lot of our Zoom meetings where we're getting training. Some of our staff go in there, we can spread them out. And then they can see the state training and participate in that kind of thing. So we're using it more for those purposes than we are for, I'm assuming you're talking about family visits,
Yeah.
or if, we're also, we'll be using it when we do some of the interviewing when we're in the crisis program in the winter, because sometimes so many folks come in, we could put, 5 or 6 folks in there, spread them out, and still have a group interview.
What kind of signs do you have on the door?
Right now, we don't have a lot of signs on the door. Most of the signs on the door talk about, all the COVID requirements, to be safe, to wash your hands, to, wear masks, that kind of thing. We're probably not getting more than 10 to 15 people coming in the front door right now, a day. Just because we're doing as much of it by mail, online, phone. So it's not been an issue now. Signage is beginning to go up. The county is getting signage printed for a variety of areas. And so that signage will be going up.
There is a mechanism that's on these telephones where you can, because I've hit it and won't supposed to be doing it, where you can reverse video on these phones. And most of the parents, the young parents, have these kind of phones that where you can talk video and
Yes,
then
ma'am. FaceTime and that Duo and those kinds of programs.
that kind of stuff.
Mhm.
Have you looked at that or whatever? And I'm not saying for the older folks, because I can't even get my regular phone working.
Well, we're using that a lot for our foster children and their parents during this early COVID period, when they wanted to visit and when the visitation was needed, as opposed to having face-to-face visits. That will eventually, in the not too far distant future, we're going to be needing to go back to face-to-face visits, because foster children and their birth parents do need to have a lot more interaction in ways other than FaceTime. For some of our interviewing, there have been probably some times that's been used. Again, folks have got to have the phone, the apps, and again, that would be something that could be used, but you don't have to have high technology to do this, because you could do a telephone interview frequently.
Sure.
I was just trying to.
Yep, that'll work.
Yeah. Any other
And-
questions?
My final questions is,
Mhm.
When Mr. Covia visits the office, I was thinking if there was a sign up that said that you have to have a mask when you're interacting with the staff.
We can have a sign up that says that we will provide you a mask. We cannot make anybody wear a mask. And we cannot refuse to serve somebody who's sick. What we would need to do is try to figure out a way to serve them differently so that our staff are not exposed. Because if we don't serve folks on the day they come in, then they may lose a day of benefit. And so we have to protect that data application. So we have to find other ways to serve people if we can't serve them face to face. But we would encourage masking, can't require
That's
it.
why I was talking about the signage, because they said, well, I didn't know we had to. But if they know, or if they're told on the phone that they need to have a mask on, a short period of time is not going to hurt anybody for the COVID's sake.
No.
Okay. Thank you, Jan. And this is probably a evolving plan.
It
We'll
is.
probably be updating it, and maybe at the next board meeting, we can have an update in the plan. And I can see you put a lot of thought into this, and your team has put a lot of thought into this, and I appreciate that. And I think it's great that Dr. Silvernail has been a part of it too. So good work. Okay, kind of moving on here. You're up on again, Jan, here.
We need to get other people back to this meeting. So
Exactly. We're going to move right into the director's report here, and we'll let you keep on talking.
okay, well, we're going to see a brief video. We've had a lot of fun the last couple of weeks trying to recognize our foster parents, and then today our graduating seniors. I know Miss Perkins Williams was out there, and there is a video, I believe, a brief montage of that. So we'll let you see that. Oops, a bullhorn. And by then my hair was dripping. Ooh, it's really quite difference there.
Just feel I need to
Great,
clap.
yeah, it was great. We have 11 graduates this year. As you see, many of them actually made it to the event. 2 of our students received $600 scholarships from the staff here at the agency. They had raised money in years past, and so 2 of the students were awarded that money. The students are going to a variety of schools. We have several going to Pitt Community College. We got ECU, A&T, Methodist, Guilford. I know were represented today as schools that these kids are going to. They were excited. I mean, one of our young ladies has finished early college. So she has a real step up on the rest. So it was a great event. WITN and WNCT were both there. So you might catch it on the TV today. But I appreciate the Public Information Office's support with that, because they were out there taking pictures, and certainly want to thank our staff for all the work that they did. And again, Ms. Perkins Williams for being out there in the heat this morning.
That's a really special thing, and we look forward to that every year. I mean, it seems like you've always done something to recognize the graduates.
Right.
So very nice.
We recognized our foster parents on May 30th
Yes.
with a lunch. It was a box lunch at Free Will Baptist Church, on First Free Will Baptist Church. They did a drive-through, received a box lunch. The children got a meal. There were lots of goodies given to them and certificates. So that was a fun event also. And you'll be seeing those in seeing the pictures from that, I'm sure, in other places. So I appreciate the PIO folks being out there for that too, because it was a fun event. About 20 or so of our foster parents. We have 32, I believe, foster parents right now. So they came to that. Judge Teague and his wife helped along with their children. So it was a fun day.
Okay, I see a hand up. I think Ms. Perkins Williams. Mary?
Commissioner Alex. Okay.
Albright.
Yes, Albright. I'm having name problem today. I thought that was good that he showed up. It was, and you worked hard. It was really good. You and your staff are to be commended. And were you there, Chairman?
I did not make it, no.
Well, it was well put together, and I thoroughly had fun. I was honking my horn and yelling.
Thank you, Mary.
Commissioner Albright and the county commissioners as a whole gave each child a portfolio and a card congratulating them on their achievement today. So,
Very nice. Okay, updates on our budget.
okay. Our budget fellas right here, but I'll try and handle that this morning. We did our presentation on June 2nd to the commissioners. Obviously, we don't know what will come from that. The county manager did recommend the income maintenance technician receptionist type position for our new building that houses our child care and our employment programs. We pushed for 4 additional positions that we felt out of the larger group were most critical. Do not have an answer on that as yet. Hopefully, I think the 15th is the public hearing. No, the 15th is when they 16th. Okay, so we will have a better understanding in the near future as to what the county feels like they can do within the constraints that they have right now. The positions that we asked for that we're really pushing for are the permanency planning program manager, the income maintenance caseworker 2 for Medicaid, a social worker for adult protective services, and a paralegal to handle the increased caseloads in child support. If you remember, we had, I think, 21 when we did the presentation to y'all. So we've cut it back significantly. And again, don't know whether there'll be money to provide that or not, but wanted you to be aware that we had done that.
Thank you. We'll keep us updated on that. Okay, update on the, on our search.
Well, I am excited to tell you that Dr. Augustine Frazier will report to work on July the 6th as the Deputy Director for Pitt County Social Services. I am thrilled. You can't know how thrilled I am.
Yeah,
You can see me jumping up and down. He is currently employed as Director of Shelter Operations and Senior in shelter in Latham, Maryland. I'm not sure I'm saying that right. Lanham, Maryland. He's been a senior program manager with Catholic Charities for 13 years in the DC area, working with the homeless population. And then lots of those support services that the homeless population needs. He's worked with domestic violence, CPS, child support, employment programs to try and connect those folks with the services that they need. He's been a child protection worker in Prince George County, which is in Maryland. And he's been an adoption and CPS worker in Lorain County in Ohio in some years back. His PhD is from Walden University in Human and Social Services Crisis and Disaster Management and Intervention. So that's a long degree title. He has a master's from Howard in Clinical Practice, Social Services Management and Administration. And his bachelor's is from the University of Sierra Leone. He had glowing references from everybody I talked to. They talked about the fact he brings people together internally. He is a great problem solver. He's able to de-escalate situations, great with data, does his homework. One of the folks talked about how he brought all these new partners from the community to the table. So I'm looking forward to having that with that kind of skill with us. He does a lot of, he said he's done a lot of counseling, homeless, grief counseling, parenting skills, children, families, conflict management, sexual orientation, and reintegration counseling. He's also developed psychosocial assessments for children and families, coordinated interdisciplinary meetings, individual and group therapy. So I think a lot of what he's done in the past, even though it's not directly North Carolina Department of Social Services, it clearly is related and should be a real asset for us. I will tell you that he also shared with me, he has 2 teenage girls. And so they're looking forward to getting into Pitt County and making this their home. So we're, like I say, really, really excited.
so he will be available for our next board meeting.
Yes, he will.
Absolutely. Well, I'm excited.
I will be sending out something to the staff tomorrow morning, and I will CC you on that because it's got a picture and all that. So I know y'all will be anxious to meet him as soon as he gets here.
Thank you, Gina. That's very nice. That's very good. Look forward to that. Okay, moving along, your Medicaid updates, application processing.
Right. There was a real snafu with this month. The state sent us one and said, no, that's not right. They sent us a second one. They said, no, that's not right. And then they sent back, oh, no, the second one was right. So that's why today you got in an email, if you had a chance to open it, the application processing report. If you didn't get a chance, when you get back to looking at your email, take a look at it. The county did wonderfully. We had 98% of our Medicaid for disabled processed timely and 95% of our other Medicaid applications processed timely. And of course, the goal is 90%. So our folks did a great job, even though applications are picking up significantly. So really, really thankful that they do such a good job.
Okay.
and I can skip right on to agency personnel
Absolutely,
and
then
then
right
move right
on.
on to staff service awards, and we'll move this along. Okay, so I think you got this in your board packet. Right now, we have 22 vacant positions. All the positions, well, actually, we can take one of them off the table. The positions are basically frozen. There are two positions, the deputy director and a guardianship position are the only two that the county manager has indicated I can fill. And so we have continued to work on those, but the rest are frozen until after we see what the budget does. And if you look at the staff service awards, let me just tell you, we've not been able to do the big celebration that the county manager does because of the COVID situation. So right now, the service awards are being given out by the supervisors with the exception of the 20-year award. And that one, Mr. Elliott and a gang have gone down to present people their watches. I say a gang, 4 or 5 folks. So we have celebrated that with Linda Mizell, who has 20 years. She got her watch the other day. And so everybody in her hall stood outside and congratulated her. I'm going to run through all the folks that we've got. We had our 5-year awards for Araceli Angel, for Araceli Asensio Angel, Sheila Farrow, Melanie Nixon, and Crystal Overton. A 10-year award went to Chandra Mewburn. A 15-year award went to Sonia Capehart, Kelly Clay, Keisha Craig, Deidre Hill, and Jenny Sugg. The 20-year I've already mentioned was Linda Mizell, and the 25-year award went to Alva Jones Hopkins from our staff.
Very nice.
So that was, we're excited for them. We've congratulated in various ways, but unfortunately they could not have the presentation from the commissioners.
Very nice. Very nice. And I'm gonna ask you to keep on talking for a second. And I copied the email that you sent us, and I was gonna read it, but your adult protective services workers got recognized.
That's right.
And I'd
right.
like you to talk about that.
Okay, well, this, of course, is National Adult Abuse Awareness Month. And the state was, in years past, we've done big celebrations around that, but it's not as easy to do right now. So the state, however, recognized, the State Division of Aging and Adult Services recognized the staff in all 100 counties with a lovely video and a certificate talking about the work that counties do and the importance that counties have in the lives of our aged and disabled in the APS arena to keep folks safe, keep folks in the community as much as possible. And so they did a beautiful presentation for us. The video had each of the folks that works in aging adult services, or a lot of those, actually talking about specific things that county departments do and telling the staff thank you. So there will be certificates for all of our staff members individually from aging and adult services that say thank you for your work, because in Pitt County, all the staff get to pitch in and help with APS, even through on call or through filling in when somebody's out. So all of our staff will be recognized with those certificates.
Yeah, that was very nice. And I wanted to make sure that we got to that.
It's the first time they ever did that.
Yeah. So, okay, well, that was a lot. That was a lot. So we're going to move on now as we close to board member comments as much as possible. So do we have any comments people would like to make? Can we do that? Jerome?
Oh, can't hear him.
Can't hear you.
All right.
There we go.
Okay.
All right. Hey, I would just like to say, hey, really appreciate the good job you're doing. Know it's tough times for everybody, but it seems like you're chartering the waters pretty good. I do think, as Jim said, it would be nice in the future if we could go back to the child social service data that you presented earlier. I think there's some key things in there that we may want to take a deeper look at some point.
Thank you, Jerome.
We agree.
Okay, who else do we have up here? Mary?
Ms. Elliott, I really appreciate what you do for the staff, for the community, and you are such a hard worker. When I drove up and saw you out with balloons and running around and a megaphone, I said, if that's not a hard worker, I don't know who is. But every now and then, this class I'm in say you should compliment those who you feel truly deserving. They need to hear it. And I'd like for this board to know that we have a fine director in Mrs. Jan Elliott. And we hope she stay here quite a long time.
Thank you,
That's
ma'am.
all I have to say.
And I concur.
Thank you. I did learn today I do not tie balloons well, so that was my career.
So the light is on. Who else wants to make a comment?
Catherine.
So I think that's Catherine Nelson. Go ahead, Catherine.
Hey, Jim. I concur. I really think Jan is doing a phenomenal job, and I'm really excited about working with this new deputy director and the partnerships that we can more partnerships that we can forge with child and adult services to keep our people healthy and safe in our community.
Thank you. And I saw Dr. Bunch put a thumbs up. I don't know whether she's able to speak or not. Nope, okay. But I saw a thumbs up, so that's a good thing. So, and I just like to concur with everything that everybody said. I think everybody's hard work and Jan's leadership and through these difficult times, we all greatly appreciate that. So, okay, so if there's no other comments, anybody else have anything they'd like to say before we close? Okay, well, if not, I'm going to ask for, well, the light went off here.
I move that we adjourn, and thank
Okay,
you for the wonderful meeting.
Thank you. Can I have a second? And I guess I'll second that. We're closed. Thank you.